Welcome to our 5-part series on working with depression. My name is Diana Winston, and I'm the Director of Mindfulness Education at the University of California, Los Angeles Mindful Awareness Research Center. I'm happy to share with you my thoughts and practices to help prevent depression and offer some mindfulness-based tools for those who suffer from depression. Keep in mind, I'm not a psychologist, but a mindfulness expert. Everyone feels sad or low sometimes, but these feelings usually pass within a little time. Depression, also called clinical depression or depressive disorder, is a mood disorder that causes distressing symptoms that affect how you feel, think, and handle daily activities such as sleeping, eating, and working. To be diagnosed with depression, symptoms must be present most of the day, nearly every day, for 2 weeks. So there's major depression, having at least 2 weeks of depression symptoms that interfere with your ability to work, sleep, eat, study, and enjoy life. You might have it once in your lifetime, but typically a person has several episodes. And then there's persistent depressive disorder, dysthymia, having symptoms of depression that last for at least 2 years with different degrees of severity. Research suggests that depression is caused by a combination of genetic, biological, environmental, and psychological factors. Sadness is only a small part of depression, and some people with depression may not feel sadness at all. Different people have different symptoms, and it looks very different in different people. So some of the depression symptoms include persistent sad, anxious, or empty mood, feelings of hopelessness or pessimism, feelings of guilt, worthlessness, or helplessness, loss of interest or pleasure in hobbies or activities, decreased energy, fatigue, or being slowed down, difficulty concentrating, remembering, or making decisions, difficulty sleeping, early morning awakening, or oversleeping, appetites or weight changes, thoughts of death or harming oneself, restlessness or irritability, thoughts of suicide or suicide attempts, aches or pains, headaches, cramps, or digestive problems without a clear physical cause. To treat depression, the first step is to get an exam with a healthcare provider or mental health professional, such as a psychiatrist or psychologist. Once diagnosed, depression can be treated with antidepressant medication, psychotherapy, or a combination of the two. Other lifestyle changes, such as physical exercise, are shown to be supportive. Mindfulness is also a potential support for people who are dealing with depressive symptoms. Mindfulness is paying attention to our present moment experiences with openness and curiosity and a willingness to be with that experience. Mindfulness can be helpful for working with depression in several ways, which we'll go over in this course. It helps with stress reduction, relaxation, and teaches us to live in the present moment rather than the past or the future, which is where depression lies. 2, it can give us tools to work with our difficult emotions as they arise, learning how to be present in the midst of difficult emotions and how to work with them. 3, it can teach us tools for working with challenging thoughts, learning not to take them so personally. And finally, it can help us bring more kindness and compassion to ourselves and to others. Mindfulness can be used as an adjunct, but not a replacement for other therapies. And for the severely depressed, it may be hard to use mindfulness at all. There is significant research showing that mindfulness is helpful for mild to moderate depressive symptoms. I hope these mindfulness tools may be helpful for you if you're finding yourself needing support around possible or current depression. The first meditations will teach you the basics of mindfulness practice. Practicing this regularly will give you the baseline tool to learn to be with the present moment when your thoughts pull you away into depressive thinking. For each session of the course, I'll offer 2 meditations, a short one that you can do on the spot and a longer one that you can do when you have some time to settle into practice. This is a short meditation for when we need to get into the present moment, right here, right now. So, wherever you are, standing, sitting, even moving, just take a moment to pause. Take a moment to stop, and if it's possible to close your eyes, if that's helpful, you can do that. And just notice your body right in this moment. Notice your feet on the ground. Can you feel the weight of your feet touching the ground? Notice the support of the ground. And even if you're many stories up, there is the earth below you. We can rest. Let our feet come to rest on the earth, sensing the ground. And just gently notice what's happening in your body. There's heaviness and lightness, vibration, tingling, tension, constriction, pleasant feeling, unpleasant feeling. See if you can let whatever is here be here. Take a breath, inviting in a little bit of relaxation if that is possible. So feel your feet. Feel your feet on the ground. Notice your body as it is. Notice your emotions. Are you stressing out about something, feeling anxious, sad, frustrated, angry? See if you can simply allow whatever is here to be here. It's okay. One more breath, feeling your feet on the ground. And notice if your mind is going off into worries, fears, ruminations. It's normal. It's okay. Just notice it and come back to this present moment. Come back to our bodies, feeling your feet connected to the ground, taking another breath. Inviting in the possibility of relaxation and ease, coming into this present moment.